今日咁早，你唔想早啲見到我咩？拒絕回答，豈有此理。佢哋叫嚟請乜事？幾時做啊？初見，你好，你好啊，係咪要飲水？我去飲水 ，OK？ 你嗰邊依家仲係14號，係啊，所以而家仲有呢個情人節嘅 transition， 仲係14號，仲用得。唔得，我要飲。哼哼。情人節快樂，情人節快樂！我今個情人節都係溫習做功課。我今日又係盡量收聲唔講嘢台，我會盡量 shut the fuck up。我情人節都係照返工，同平日冇分別。耶，只係一個普通嘅人。大家咁話，大家咁話。唉，好啦，我收皮，唔講嘢，做嘢開始。要唔要呢個時間計90分鐘 focus。又實咗你留言，講咗乜嘢啊？咁啊，你加油，我都跳得 我都 Q 得 Q 得 Q 得 Q Q 得 Q 得 Q 得 Q 得 Q 得 Q 得 Q 得 Q 得 Q 得 Q 得 Q 得咩 Q 得 ？Shut up 。OK， 好。殺鴨。好啦，我 shut the fuck up， 我 shut the fuck up 做嘢。早晨啊，藍健，早晨啊，又係啊，痛苦嘅工作台，每日痛苦嘅工作，同埋儲呢個 YouTube 時數。我已經開始叫呢個 GOGH 叫 YouTube 儲時數台。一個喺度問我點解我啲時數儲到咁多嘅，跟住我同佢講 GOGH 一個字 GOGH。原來開題為咗儲時數，冇發現到添，咁都發現唔到咁明顯嘅嘢，咁明顯呢啲嘢梗係攞嚟儲時數。唔係，呢個係我發現之後做下發現可以做到嘅嘢。即係我喺度諗，即係我有時開呢啲 GOG 台喺度諗啊，會唔會好似好衰咁樣咧？即係我做緊嘢，跟住有時唔講嘢，所以你哋喺度做乜嘢？即係陪我，好似覺得開頭好似冇乜貢獻對呢個世界。不過發現唔係喎，可以儲時數幾好，算啦，我無恥地開啦。咁我以為你係一個冇心機嘅人咯，咁我以為你係一個冇心機嘅人嚟噶嘛？你講緊 YouTube 冇心機，即係喺 YouTube 發展上面做 VTuber 上面冇心機，都係嘅。呢個咪係最冇心機嘅儲時數方法咯。呢個係 passively 儲時數。假流的女人，機心啊心啊機心，唔好意思。你見到我連機心都讀唔到，你覺得我會好有機心？我可以嘅，我可以好有機心嘅，不過太難。機心啊，有時會我只係會對一啲有機心嘅人先會自己都有機心，都用有機心嘅態度去對佢哋。VTuber 人均將留言調轉日常，機心 ，Oh my god！ 你講得啱，我係有機心，機心我係有嘅，機心係有。咁你俾心機溫書啦，我會留低藍肩背，唔緊要，你哋唔使留喺度，我冇逼你留喺度。係咪？ 我冇逼你留喺度，我絕對冇逼你哋留喺度，係咪？我絕對冇逼你哋啊，係咪？傻豬嚟嘅，我哋唔留喺度點儲時數？算啦，呢啲工作台用嚟掛台或者係咯。如果你大家想做嘢嘅話，都想即係專心做嘢，又唔想即係篤手機，可以開下個台嚟 occupy 你手機嘅容量。Let me out， 我唔想喎。You keep going，OK，放返你出嚟。BGM horrible， 唔係啊，我覺得我喺我監倉入邊嘅 BGM 幾好聽，我嘅監倉 BGM 唔錯。你有冇得最後嘅問題係？請講。係一沖咗涼未？一陣間沖，琴日沖咗，一陣間沖，好冇？OK，拜拜拜。有冇撳開始呢個 focus？ 點解意思？ 52-year client is skeptical about the potential harmful effect of their smoking on their heart, citing the fact that a parent and grandparent both live long lives despite lifelong smokers. Which of the following facts would underlie the explanation that the nurse provides the client? I don't fucking know. The statement by the client best demonstrates effective help from motion teaching by the nurse to reduce the client's risk of developing cardiovascular disease. I'm going to start running as soon as the weather gets warmer. No. My blood pressure is managed well by the medication I was prescribed. Yes. I've joined a smoking cessation support group that meets regularly. I've been trying to keep my stress levels under control by meditating. That's good. My parents and I have been fixing recipe for a low cholesterol cookbook. That's good. That's good. During an interview with the nurse, a client reports fatigue that seems to get worse in the evening. Which of the following cause of fatigue would explain this pattern? Severe muscular exertion, depression. No, fatigue seems to worsen in the evening. Decreased cardiac output, aberration. I think it's exertion. When auscultating the heart sound of a client, a nurse note that the S2 sounds louder than S1. How should the nurse describe the S2 sound? Accentuated. 58-year-old teacher presents with breathlessness with activity. The client has no chronic conditions and does not take any medications, herbs, or supplements. Which of the following symptoms is appropriate to ask about in the cardiovascular review system? Orthopenia? Sometimes I just base answer out of like what the word means, kind of, because like penia is always like about the respiratory system. So if it's out of breath, then that's the only word that associates with that case of symptoms. So knowing English sometimes works. Knowing like suffix, those things sometimes works. Client has sought care with reports of increased swelling in their feet and ankle. and the nurse assessment confirmed that the presence of bilateral edema. The nurse subsequent assessment should focus on the signs and symptoms of what health problem. Heart failure, myocardial infarction, heart block, atherosclerosis, heart block. I forgot what is atherosclerosis. What is that? Disease arteries to depression, plaque, fatty material on their inner walls. It could be that. I feel like it could be that. Edema. I think is that atherosclerosis? A triage nurse is working in the emergency department of a busy hospital. 4 clients have recently been admitted. Client A has an arrhythmia diagnosis as atrial fibrillation. Client B is in chronic congestive heart failure. Client C is assessed and found to have a probable pulmonary embolism. Client C reports of chest pain relieved by nitroglycerin and rest. Which client? Okay, it's either B or C. A has arrhythmia diagnosis in atrial fibrillation. That's not too bad. They're not gonna die yet. B, chronic congestive heart failure. Well, it's chronic. Are they gonna die right now? I need to know their vitals. It says it's found a probably pulmonary embolism. I forgot what that is. I don't think that's good. Pulmonary embolism. I forgot what embolism means. Sudden life-threatening blockage in one or more lung arteries, typical cause boycott. I think they might die. I think they can't. I think that's bad. I think that's not good. I think it's C. I don't like the. What about chronic congestive heart failure? Are they dying right now? Are they dying right now? They're fine. They're fine. It's chronic. They have it for a while. Variations in the presence of S1 are due to alteration of which heart valve? Ah, fuck. Tricuspid? Is it tricuspid? It's tricuspid, right? Mitral? Fuck. Closure creates a loud, early component of sounds. Fuck me. The nurse placed the stethoscope on the third intercostal space at the left sternal border. Which area is the nurse auscultating for heart sound? Herbs? 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 Is it herbs? herbs? Yes, it's herbs. Nurse performs an initial health history on client admitted for new onset of chest pain, which data is considered subjective of the cardiovascular system. Subjective? No edema, no current medication. You're sorry. No edema of extremity noted. No current medication or treatment. Real heart rate needed. Real impulse palpated at 5 intercostal space on the left. I think that's subjective. The nurse is assessing client's heart and neck vessel. Which technique would be the most appropriate to use when examining the jugular venous pulse? Lie client flat, 30 to 40 degrees. Head turned slight to the left. That'll be the jugular. I am, as always, studying. Nurse auscultates the client's heart, sounds, and obtains a rate of 56 beats per minute. How should this rate be documented by the nurse? That's normal. It's kind of heart rate. Well, the normal range is 60 to 100. But if you're like an athlete, if you like work out a lot, that's not that bad. But it's still under 60, so is bradycardia. The bicuspid or mitral valve is located between the left atrium and left ventricle. Beginning of the area, the exit of each ventricle near the greatest valve. I think is the left atrium and between left atrium and ventricle. Or am I wrong? I'm right. Oops. In order for a nurse to observe the jugular venous pulse, the client should be in which of the following position? High fallers? Or just semi? Okay, semi. High is 60 to 90 degrees. Okay. The nurse hears heart-pitched swishing sounds over the carotid artery and on the right side. What's the sound indicator of? Bruise. When auscultating the heart sound of a client, a nurse notes that S2 is louder than S1. How can nurse know S2? Didn't I already answer the question? Accentuated. When conducting physical examination of the cardiovascular system, the nurse hears fine crackles on auscultation of the lung. This finding is most likely a manifestation of what problem? We didn't learn about this shit. What do we mean? Crackling. Did we? What is crackling? Congestive heart failure. Let's go. On the right side. Specifically. The nurse performed a part of neck assessment by gently pressing 2 fingers into the depression between the tracheal and sternal-mastoid muscle in the anterior neck. What is the nurse assessing? Anterior neck. Tracheal carotid artery? Wait, no, that's wrong. Fuck, I'm stupid. I'm stupid. I'm wrong. I think I'm wrong. Okay. Oh my god, I'm stupid. Some of these are stupid. Bilateral swelling from the feet, ankles, and also bilateral edema is heart failure. Why? Edema of both lower extremities at night as seen as heart failure due to the reduction of the blood flow out of the heart, causing blood running to the heart and back up to the organs and department areas of the blood. Edema is not associated with MI, heart block, or atherosclerosis. Okay, heart failure. The nurse conducted a workshop on the measurement of jugular venous pulsation. As part of the instruction, the nurse tells the student to make sure that they can distinguish between the jugular venous pulsation and carotid pulse. Read the following pulsation illuminated, typical of carotid pulse. Pulsation illuminated by light pressure on the vessel. Palpable. Level of pulsation change with changing position. I think it's palpable. Level of pulsation change when changing position. Oh wait, it might be that. Oh, it is palpable. The nurse cares for a client who suffered from myocardial infarction 2 days ago. A high-pitched, scrapping noise is heard that increases with exertion. Excuse me. Heard from increase when exhaustion and when client leans forward. The nurse recognizes sound as a result of what process occurring within the pericardium. Myocardial infraction. Scratchy scraping sound. I guess the pericardial sac, since result of process occurring within the pericardium. Pericardial friction rub is the scratchy sound. Okay. The client with dehydration or volume depletion is barely visible neck veins, even when lying flat. These described as what? Flat? Distant? What's the term? Flat. Nurse is assessing a client who isolates decompensation right side of the heart failure. Isolated decompensation right side heart failure. Which assessment does a nurse associate with right side heart failure? Bradycardia, increased feels, crackling lung, bounding peripheral pulse, jugular pressure. So that or bradycardia, I feel like. Yeah, it's the... Wait. Yeah. The nurse hears high-pitched swooshing sounds over the carotid artery in the right side. That's bruise. When oscillating heart sound or client, the sound is accentuated in order to palpate the apical pulse. When performing cardiac assessment, where should the nurse place their finger? Right side artery. Left line, fifth intercostal space. The nurse is a female client who smokes cigarettes and has hypertension. Which factor would increase the likelihood that the client would develop metabolic syndrome? Waist circumference of 30 inches, family history, high HDL cholesterol, fasting blood glucose of 110 ml. Cholesterol or fasting glucose. Isn't the glucose really high? Fasting glucose level, normal range. Normal range is less than 100 mg/dl. After teaching a group of students about blood flow through the heart, the instructor determines that the teaching was successful when the students state that after being received by the when the students say after being received by the atria, the blood goes to which of the following? Semi-lunar, no. Oh my god, I forgot everything I learned about heart. Ventricles. Social nurse assessed a client for pulse rate deficit. Says for difference between apical pulse and radial pulse. Auscultate for a split S1 at the base of apex. Observe for a decreased other vein pressure. Check for pulse inequally between right and left. Inequally? The nurse assistant client for the first heart sound. The nurse interprets the finding as indicating which heart action. S1 closure of valves, closure of atrial ventricular valves, beating diastole, isometric contraction, closure of semi-lunar. No, it's AV valve. Fuck. Atrial ventricular. I'm forgetting all my heart stuff. Close of AV. Loudest as apex and lowest as sternal border. close of AB. Dub is close of SL. When describing cardiac cycle, the group of student, the nurse, and instructor correlates a hard sound with events of the cycle. We hear the hard sound with instructor claim being associated with a systolic. That is S. I want to say S1. Tremors used to describe the degree of vascular resistance to ventricular contraction. Degrees of vascular resistance to ventricular. The degree of vascular resistance to ventricular contraction. Contractile overload. Afterload. Fuck. Pre-level limb coming into the ventricle and the diastolic pressure. Nurse assess a hospitalized adult client and observe the client's jugular veins are fully extended. The nurse contact the client's healthcare provider because the client's signs indicate of pulmonary emphysema. Central venous pressure. Damn it. Group of nurse interviews several ECGs. The student demonstrates understanding of waveforms when they identify which component as the indicating of ventricular repolarization. T. I need to study my EKG. Yes, I'm right, it's T. T. PQRS. T. The nurse preparation to assess a client's core arteries, which are most appropriate pelvic arteries before yes, ask the client to breathe in and out deeply. Use the diaphragm of the scope. Palpate each artery individually to compare. Yes. The nurse is assessing the client's heart and neck vessel, which is the most appropriate to use. Example in general 40 degrees. Sit 30-40 degrees. Nurse is assessing client for possible dehydration, which is following is should the nurse do assess for difference between apical and radial. Observe decreased jugular veins, prepare for pulse and negatively between right and left cardiac. I actually don't know. Dehydration. I bet is decrease in JVP. Nurse determines client at risk of cardiac disease when the client states which of the following. High risk of cardiac disease. I am a Wait, this is kind of funny, guys. Okay, the question is, a nurse has been assigned to a group of clients. The nurse determines a client is high risk of cardiac disease when client states which of the following. Answer 1. I am a computer programmer. Not gonna lie. That is a bias, but kind of true. I am mostly vegetarian. No, that's fine. My job is stressful. It could affect, but not really. That's not high risk. I don't drink a lot of alcohol, only occasionally. I smoke 2 packs of cigarettes every day. You smoke? Yep. I think that's, yep. 2 packs of cigarettes would be a high risk. Cardiac patient. Oh my god, I got a 20 out of 20 correct. Let's go. Our job is so stressful. I am a computer wait, what the fuck? Guys, one of the answer, like, you can choose, select all that applies. So I only choose I smoke 2 packs of cigarettes a day as a high risk cardiac disease patient. But apparently, my job is stressful and I am a computer programmer is also a high risk for cardiac disease. Guys, you shouldn't be a fucking computer programmer. You're gonna have a higher risk of getting a heart disease. Well, I guess like being a nurse also, because you're stressed out. Also, like, you guys know that if you do a lot of night shift gives like an increased rate of getting cancer. You're more likely to get cancer if you do night shifts. We're all gonna die. Night shift people, careful. The nurse places the cursor on the third intercostal space on the left cerebral, which of the area is the nurse auscultating for the heart sound. Third, I think it's herbs. New nurse on the telemetry unit is reviewing information about how to correctly read electrocardiograms. The nurse is expected to know the PR interval represents what event. Spread of depolarization in the atria, the time of firing SA note to the beginning of the depolarization, the relaxation of the ventricle, the spread of depolarization. The time, I think for SA note. Shit. Yeah. The nurse knows that the client heart rate increase when inspiration and slow down when expiration. How should the nurse document this finding? Premature atrial condition, sinus arrhythmia, sinus bradycardia, pre-amateur ventricular contractions, sinus arrhythmia. Which statement describes the correct technique by a nurse for use of stethoscope to auscultate the chest for heart sounds. Stand at the client's left side to perform the entire assessment for position. Elevate the head of bed until the examiner can comfortably reach the client. Auscultate it to determine heart rate, and if the rhythm is normal, listen with the bell to a high note. Bells not for high-pitched sounds. A nurse has been assigned to a group of clients such as high risk of cardiac arrest. I am a computer programmer. High risk of cardiac disease. I smoke 2 packs a day, obviously. My job is stressful. The nurse is performing a part of an neck assessment by carotid arteries. The nurse assessment of client reviews circular venous distension. The nurse should conduct a further assessment of which problem. Is that heart failure? Is that heart failure? Heart failure? There's an inclined heart and neck vessel. Everything was appropriate. The nurse conducted a workshop on measuring the instructions. The student is asked to define a continuous rhythmic movement of blood during contraction. What? Define the continuous rhythmic movement of heart during the contraction and relaxation of heart rate. Cardiac cycle. Cardiac cycle. Cycle. Yeah. Which technique would be most appropriate to use in examining the jugular and inspecting Performing clients to find position straight ahead. Expects supine large round clavicles. 90 degrees. Performing client with supine. Look straight ahead. Chin slightly lifts. Client is engorged. Has engorged jugular veins, which finding suggested a nurse. Closure of triclosis valve. Right atrial pressure. while I am studying again. When auscultating a client diagnosed with atrial stenosis, the nurse should place the stethoscope at which location of the chest? Aortic stenosis. Aortic stenosis. I guess it's an aortic valve. The nurse assessing clients for first heart sounders towards finding as indicating which beginning of diastole no and closure of a vestibular valve. When palpating the apex left sternal border and base in adult client, the nurse detects a thrill. The nurse should further assess client for thrill. Is that heart failure? No. Murmur? A thrill. Cardiac murmur. Usually, I don't think you can easily palpate that. The nurse is assessing client with an isolated decompensation right side heart failure. Which symptoms does the nurse associate with the right side heart failure? Is then increased jugular venous pressure. The client has a long history of heart failures with neutral lung signs and symptoms criteria output. Shortness of breath and exertion, absent pedal pulse, lack of hair, low extremities, fatigue. Yes, pedal edema. I think it's history. The nurse knows the client's heart rate speeds up with inspiration and slows down with expiration. Sinus arrhythmia. When assessing an adult client, the nurse detects opening snaps early and in diastole during auscultation of the heart. The nurse should refer to the client to the healthcare provider because usually indicated of snap early diastole during auscultation. Pulmonary hypertension. I think it's pulmonary hypertension. And characteristics of the first heart sound would which of the characteristics of the first heart sound would the nurse expected to hear claim with mitral insufficient. Diminishing, I guess? Okay, what did I got wrong? Get down, you expect suprasternal notch around the clavicles. Oh shit. Detect snap early. Snap early and diastole during auscultation. Oh yeah. Mitral valve stenosis. Guys, cardiac is so fucking annoying. There's so many disease you have to remember. Mitral valves stenosis. Narrowing of the mitral valves restrict blood flow from the left atrium. Also, I hate it when they have different names. Like, tricuspid is also called the AV atrial fucking ventricular valve. And then the mitral valve can be also called the semilunar valve. Piss me off. Why do they make different names for them? Why? Or bicuspid? Wait, okay, wait. Or bicuspid. Wait. Semilunar valve. I don't know anymore. What the fuck is semilunar valve? Where the fuck is it? What the fuck are these names? I mean, I'm stupid. No, the semilunar valves. They're the aortic and pulmonary valves. Okay. And the AV valves are the tricuspid and mitral valves. But the tricuspid valve on its own is on the right, and mitral is on the left. Tricuspid valve is also called what the fuck is it? What's the other name? Mitral is also known as bicuspid valve. There's a tri is on the right, bi is on the left. What is tricuspid also called? Tricuspid valve. Right atrial ventricular valve, I guess. The right AV valve. Okay, it's only mitral or bicuspid valve that has a random ass name. Why? Why did they give them so many random ass names? Stop giving them names. Stop. Okay, I remember now, okay. So between the right atrium and right ventricle is the tricuspid valve, or the right AV valve, and between the left atrium and the left ventricle is the mitral or bicuspid valve. Okay. and the tricuspid and mitral valve, they are called the AV valves. Atrial ventricular valves. And from the right ventricle to the pulmonary artery is the pulmonary valve, and of course for the left ventricle to the aorta is the aortic valve, and they are called the semilunar valves. Oh my god. I fucking forgot. These fuck-ass names. They had to make random names. Why did it have to make so much names for these things? The nurse is assessing client who had complex cardiac history. The nurse has asked the client to lean forward while in a sitting position. This position would following impact client heart disease or mobility. Assess the client's heart sounds while preventing shortness of breath. Differentiate heart sounds from breath sounds. Identify heart sounds that may be inaudible in other position. I think that is it. Let's drill the third heart sound. It marks atrial contraction. It is not heard in atrial fibrillation. It reflects normal compliance. No, it's caused by rapid deacceleration against the ventricle wall. I think it's that one. What is atrial fibrillation? Is it? Atrial fibrillation. I don't know. I think it is caused by rapid decreased declaration of blood against the ventricle wall. Maybe, I think. Is it? The nurse recognized second heart sound as S2 produced by which of the cardiac reaction closure of the semilunar valves. A client with heart disease is a current cigarette smoker, which would the nurse include the caring of the client? Assist with finding resources? What kind of fucking resources? Arrange for follow-ups, yes. Assess with willingness to quit. Acknowledge independence. Advise to quit. It's just, I guess all of them. I don't fucking know. The nurse is reviewing dietary changes for the client with hypertension in order to manage condition. Which would the nurse include in teaching? Hypertension. Have dietary intake of more than 3,500 milligrams of potassium per day. How much potassium per day? Adults. I guess. Consume 2,300 milligrams of sodium. No. Eat less. Good luck studying. Thank you, Rena-san. Irashimasu. Konnichiwa. Use alcohol in moderation. Use? What do you mean use? I guess so. Use low-fat dairy product with reduced saturation and total fat. Include more fruit and vegetables in meals, I guess. Nurse suspected the client may have pericardial friction rub. To ensure the nurse hears this, the nurse would place the client in what position? Sitting, leaning forward, 30 supine 30 degrees, supine 30, leaning forward. Fucking hell. Okay, scratching noise. The friction rub scratching noise is lean forward. Okay. The nurse is auscultating client's heart sound. What actions should the nurse perform during the assessment? Use a bell or it is in the diaphragm. What should you suppose? Auscultate prior to inspection palpitation. Start by auscultating client's breath sounds. Systematic listen to entire pericardium. Yes. Precordium? No, not precordium. Should be spelled auscultating client heart sound. What action should nurse perform during this? Precordium? Am I right? Yes, okay. The nurse has begun the objective assessment of client's heart and neck vessel. His client's jugular veins are normal and then hell. Jugular vein pulse is visible when client no. The jugular veins are distant when client pulse is not visible when client sitting upright. Jugular veins are fully distant. Jugular veins pulse is visible. Client is supine. Are distant. 45. Client diagnosed with mitral valve stenosis. Use a diaphragm. Where should the nurse identify his valve when teaching clients? No problem. Oh my god, I have to point it out. Mitral valve stenosis. I guess a fucking mitral valve. Here-ish. Here, I guess. What's my pussy ball song? Yes, I must have created you all. I'm studying. Hello. It might be a bit boring. The anterior chest area that overlies the heart and great vessel is called heart and great vessels. Myocardium, endocardium, epicardium, precordium. I forgot all the cordiums. Forgot all the layers. Forgot all the layers. Precordium. No, I'm studying nursing. I'm studying health assessment. You don't study like that deep into human anatomy in biology, in like general biology. Well, in Hong Kong we do. It depends, but in US they like differentiate pretty well. In Hong Kong, in biology we do like the whole system, but like when I'm studying right now, I'm studying like heart disease, cardiac disease. Now, what is like into pathology and stuff, normally biology won't cover that deeply, I guess. Yeah, it's more specifically human anatomy than biology, I guess. Or also pathology. I'm not a nurse. I'm just a student. I'm not an actual nurse. Yet. The nurse on cardiac unit is caring for a client who thinks they were having a myocardia infraction when they came to the emergency department. Reviewing laboratory data on this client, the nurse noted that all tests within normal limits except for the cholesterol and C-reactive protein, both of which are elevated outside of normal range. The nurse should be aware of the fact relating to elevated cholesterol and C-reactive protein. They are both sensitive to specific heart failure. They are more than double the risk of cardiac disease. They have no direct correlation. The client proved that they are clinical proof the client had coronary event. Double the risk of heart disease, I think. The nurse also stated the heart rate of a young male. Notice that the rate speeds with inspiration and slow with exhalation. S1, S2 normal. Sinus arrhythmia. Care for a client who suffered from myocardial infarction 2 days ago. In the pericardium. Heart increased exhaustion, leans forward. Pericardial inflammation occurred. Heavy scratchy noise. Pericardial sac, inflammation of pericardial sac. A nurse is working on a client who recently suffered a heart attack. As a result, the client has experienced the death of a muscle tissue that makes up the thickness of the layer of the heart. This is a layer of the heart which is following myocardium. It's myo is muscular, right? Myo is muscles. The nurse assessing a client diagnosis with mitral stenosis, which technique should be celestial apex of the left. Client leaning forward. Left carotid artery. Therapist should still listen to the right sternal border. Left carotid artery. Bell, stethoscope, apex. Client lean forward, left carotid artery. Diaphragm, stethoscope, listen to the right sternal border. Okay, supine, bell, stethoscope, left intercostal space. Apex, left side. A nurse assessing client for position dehydration, possible dehydration. Listened to observe decrease in jugular venous pressure, JVP. The nurse analysis data from the assessment client hearts and neck. The first sound corresponds to the heart rate to the atrioventricular valves. Closing. Vendors review the EKG, demonstrating understanding which components of the ventricular repolarization that will be the T waves. Nurturing conducted exams of the cardiovascular system. Which following instructions should be nurse provide a client preparation for the examination? You will stand. No, you will be laying on your left side. You wear gown. No, you will be conducting examination to your left side. You will be sitting and leaning forward. Cardiovascular system. You can lean forward for some parts. Stand. Sometimes you can stand. Sometimes you will. I don't stand enough. I think they're just sitting up. Conducting examination from the left side. Could be. Backgrounds. No, you will be laying on your left side. Not really. When oscillating client's harsh sound, nurse detects a murmur that is initially loud and then gets soft. There's a different pattern of this murmur of which we're calling. Oh, I don't actually know this. Decrescendo. Crescendo? Decrescendo. Decrescendo. Let's see. How many I fucked up? Eesh. I fucked up 3. Fuck! Let's see what I got wrong. Oh. Alright, quit. A nurse can follow 5 A's when assisting client when smoking cessation. These A's include advise to quit, arrange follow-us, assess client willingness, and assisting with finding resource. That's 4. Assess to quit, arrange follow-us, assess client willingness to quit. That's 4. What do you mean? Oh. There's, okay, they put it in last. Acknowledging independence is not, okay. Wait, that's only 4. What the fuck? They only list 4. What do you mean? Oh, assisting in client? Assisting, I guess? Another assisting? Quit. Follow-up. Willingness to quit. Finding resources. Wait, let me look this up. Arrange follow-ups? Okay, ask about it. Advise to quit. Assess readiness to quit. Assess to quit. Arrange follow-ups. Okay. Nurses begin the observability. Normal. Juggler JVP is not visible when client is sitting upright. Okay. Juggler venous pulse is normally not visible when sitting upright. Juggler venous distension and visible juggler venous pulse in supine position are pathogenic findings. Bum, 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 bum. Crescendo decrescendo. What the fuck? Okay. Crescendo decrescendo. Louder then growing softer. Initially loud is also called decrescendo. Crescendo decrescendo. God damn it. It didn't say it gradually get louder. Fuck this thing. client is noted to have a pathogenic change in ventricular compliance. What information from the cardiac assessment would indicate this? Ventricle compliance? Ventricle compliance. Delayed S3. Gallop S3. Split 2. Week 4. Gallop. S3 Gallop. After teaching a group of students about the traditional areas of oscillation of the heart sounds, they just determined that the teaching was successful when the students identified which location of the earth point. Second or third intercostal space on the left sternal border. Third intercostal space on the left sternal border. I think it's the third. Fifth intercostal space near the left mitral line. The third. The nurses oscillating a patient's heart sound. They hear the first heart sound, which indicates the beginning of the systole. The nurse knows which structure slightly delays. The incoming electrical impulse from the atrial before relying to the impulse to the ventricle, cause them to contract during this phase. It's a bundle of his? Is it a bundle of his? No, it's AB. Oh, yes, it's AB. It's AB. It's AB node. It's not bundle. The nurse instructor explained the group of students what can shorten diastole. Filling pressure. Blood pressure, increased heart rate, decreased respiration. Filling. No, wait. Systole. Diastole. Oh. Is my resting time. I have to finish this though. Increase heart rate. Hold on. I have to pause this. Because I need to finish this thing. Increase heart rate. Shorten diastole. Oh no, I'm not done. I have another 1.5 hours. What is the most important lifestyle change a client can make to improve cardiovascular health? Getting less exercise and more rest? No. Living more sedentary life? Eat a diet high in fat. Quit smoking. Quit smoking. Smoking bad. Guys. For this session? Okay. Smoking bad. The nurse reviews client cardiac output. The nurse identifies which cardiac output as being within the normal. Oh, fuck. How many liters is the output? Fuck. I forgot. 4, 6, 6, 6. There's no 5. Six. Is 4 too low? 4 is a bit too low. 6 liters per minute. That's a lot. We pump out a lot of blood. Client might have an aortic regurgitation. I can't say regurgitation, remember. Which is the best position to accentuate the murmur? Lean forward. Do we listen to murmur? Lean forward, lean forward. Forward? No, wait, straight. Upright? Do we listen to that? Straight, upright. Lean, yep, it is lean forward. Clients present with the following signs of symptoms: a 5-pound weight gain in the past week, coughing up pink tinged sputum, crackles in bilateral lung fields, difficulty lying flat, and reports of waking up in the middle of the night, extremely short of breath. Based on these findings, nurse suspect which the following orders: coronary artery disease? No, wait. Oh, it's paroxysmal nocturnal dyspnea, right? Because nocturnal night, dyspnea, can't breathe well. I think. I don't know. There's auscultating a client's heart sound. What action should the nurse perform during the assessment? Auscultate prior injection. Use a bell ready to start by auscultating results of the pericardium. Nurse assesses on client reveals cellular distension. Nurse is measured with problem. Heart failure. Heart failure. Heart failure. Heart failure. The client asked the nurse if a small P wave in an ECG indicates. What would the nurse aware? Atrial depolarization, ventricular depolarization, ventricular atrial depolarization, right? Atrial? No, wait. Yes? Atrial depolarization. The nurse providing teaching about cardiovascular disease in a community setting. What risk factors would identify the group as those that can modify their lifestyle choices apply? Cholesterol, blood pressure, smoking. Client scheduled for pacemaker insertion does not understand why device is needed. Where should the nurse identify location of the single note on the diagram for the surgery? Oh, fuck. Oh. Fuck, which one is it? Single note. Which fucking note is it? It's the SA note? This one. The nurse received a client from the cardiac catheterization laboratory. The client is on bed and has a weight on the puncture site of the right groin. What must nurse assess for it frequently? What? Cardiac catheterization laboratory. Client rests a weight on puncture site on the right groin. Bleeding at the puncture site. Hematoma. I forget what this hematoma. Something about blood. Oh, is it bruise? Doesn't look at the condition. Clot of blood outside the vessel. It's kind of like bruise looking ass. Bruise looking ass thing. Increased blood pressure, which could cause excess blood in hematoma pulse. Proximal to puncture site. I guess all of them. While assessing an adult, the nurse detects opening snap early during the auscultation. Is referred to client because snap early is mitral valve stenosis. A term used to describe the degree of vascular resistance to afterload, resistant to ventricle contraction. Afterload. The nurse experienced difficulty with palpitation on the apical impulse on the precordium. What is an appropriate action by the nurse? Use difficult to auscultate. Try using one finger of the domain to locate the pulse. Ask client to assume left lateral position. Instruct client to cough and count again. Auscultate, I guess. There's auscultate the heart rate of a young male and notice the rate speeds with inspiration, slow exhalation. Sinus arrhythmia. When palpitating the apex left sternal border, the base and adult client the nurse detects a thrill. Thrill is on the apex of the left sternal border. That is thrill. Cardiac murmur. Assess cardiac murmur. A nurse recognizes a second heart sound is produced by which action? Close of the semi-lunar bounds. What the fuck did I get wrong? Let me see. Oh, it's not. It is heart failure. Fuck. Client present with knowledge of signs. Weight gain. Cough up pink sputum. Crackles in brittle lung field. Let me see explanation. Client exhibits signs and symptoms of heart failure, which indicates unexpected weight gain, fluid in the lungs, backing up. That's why they cough up shit. Crackling. That means fluid. Causing pink sputum. Orthopenia. Typical lying flat. Proximal nocturnal dyspnea. Okay, so it was everything, but all of them add together is the signs of heart failure. They're not disorders. Orthopenia and proximal nocturnal dyspnea are symptoms, signs, but not a disorder. So I'm stupid. Those are symptoms. No, sir. Distal circulation, not proximal. Left lateral, if it's hard to. Difficult palpitation in the apical impulse on precardium. Left lateral position. Why? If unable to locate the apical impulse, ask the client to turn to the left lateral position. This displaces the heart towards the left chest wall and relocates the apical impulse further to the left. Using the finger is appropriate after locating the pulse for more accurate palpitation. Coughing will not assist anything, of course. You should locate apical impulse by palpitation before asking. Yep. Okay. I'll take a break. I'll take a 10-minute break. And stretch. Oh my god, my YouTube is. Oh my god, my YouTube. Oh yeah, because all the EN boys are doing their Valentine streams today. That's why my notification is blowing up. Oh my god. No, Axel is making candy. We're so fucked. Hydrate, okay. Eat zucchini. Eat zucchini. Eat zucchini. Eat zucchini. Do you read me? Like the emoji? I want you. How would you hurt on the internet, girl? Take a picture of me. It's oh my god, it's her. What the word on the internet, girl? Click who you hated. Jealousy's so overrated. It's not too much I feel. I'm getting out of here. Eat zucchini. Eat zucchini. I usually play a stream or two in the background while studying. I cannot focus if I do that. I know I can only listen to really soft music or absolute silence. Or I unlocked a new thing, which is just random ass sounds in the background, which means I can study in a library or a cafe while people are talking in the background. Like, people talking, like, in a crowded place is my white noise for some reason. I can make people loudly talking in the background as my white noise. I don't know how I do that, but I can filter people talking. 원딥상 이라시마세 konnichiwa. Me too? Nice. Let's go. Because I know some people are very sensitive to like people talking, like little sounds and stuff, but I can filter them pretty well. I guess as a person who is born in a city in Hong Kong, I'm so used to having loud noises and shit. But I can't. Okay, like it has to be constant. Either there's like constant people talking, or just like straight silence. So I need like a constant sound. I can't have sudden loud sounds. Like if someone suddenly coughs, sneeze, breathes loudly in like a really quiet testing room, when there's mostly just like writing, flipping pages and stuff, when they do like a sudden noticeable sound, it will distract me. So any sudden change would distract me, but any constant sounds is fine. Probably the thing I'm studying are not as hard as yours, so it works for me. Yeah, it really depends on what you're doing. Like, sometimes for math, I can just turn on auto drive for doing math. But for like very informational things to study on, I have to lock in and have less sound as possible. Little noise can affect me. Yes. Just little changes will affect me. Okay, I'm playing Love and Deep Space. I got 4 more minutes of rest. Wait, why is there no BGM? Is it fucking playing? Oh, it is playing. It was just like the starting sounds are barely noticeable. It's my first time ever watch a live. Welcome. Sorry that your first time. It's me doing work. I do a lot of working stream because I'm busy now. But if you want something that shows more of my personality, or like shows what I can do, am capable of while I stream, I recommend my Valentine's Day stream I just did yesterday, because I think that's pretty fun, and I put a little more effort than my usual stream. It's a special little stream, so yeah. If you want, of course, if you want to, you can check those out, or like you can check out like my anniversary compilation streams. That's what I'll recommend if you want to get to know me fast. No, hold on. Let me finish this fucking. Story first. Also want to change BGM. I can't do that. This one. Also, it's almost fucking Lunar New Year, Chinese New Year. Happy early Chinese New Year, guys. What do I do on Chinese New Year? I study and go to school and practice. Happy early you too. My plan for holiday is also studying. Let's go. Let's suffer. Okay, I've rested enough. Kind of. So, I'm going back to studying. Alrighty. Let's continue. Another quiz. There's a current McLaren had special jewelry vein detention and dyspnea. The nurse auscultate and new S3 heart sound. What is the nurse's best action? Place client in the supine position. Encounter increased PO fluid intake, increased intravenous fluid air rate, administered in prescribed diuretic. Drink water. Increase intravenous fluid rate. Explaining. Intercalated dyspnea. I don't know. Drink more water. Intravenous, I think. Fluid rate. A nurse cares for a client who suffered from myocardial infarction 2 days ago. High-pitched scratchy noise. Inflammation of pericardial sac. Nurse instructor is teaching nurse student proper techniques of swing surgery, which is to demonstrate properly understanding. Auscultate for pulse rate deficit if heart rhythm is irregular. Palpitate carotid artery before auscultating them. Yes. If experiencing difficulty differentiate S1, S2, palpitate the carotid pulse when listening to the heart. No. Place the client in a left lateral position when palpitating apical pulsation. You don't have to. Palpitate the carotid arteries one at a time. Yes. Client is noted to have pathogenic change in ventricular compliance. Which form of the cardiac assessment would indicate this? Gallop. Solution to all these is 飲多啲熱水. That's the Chinese way. Which statement describes the correct technique of nurse for using stethoscope to auscultate the chest heart sounds? Listen to the bell. No. Elevated bed. Reach height. Auscultate. Determine rate. Elevate the head of bed until exemplary corner. Auscultate to determine heart rate if the rhythm is normal. Client left side perform injury. Okay. While assessing an older client, the nurse detects bruise over the carotid artery. The nurse should explain the client really is associated with artery disease. Heard by arteries almost totally occulted. A normal sound, nope, wheezing sound. It's not a wheeze, it's like a sloshing sound. Occultive artery disease? No, arteries almost totally occult. Variations of the presentation S1 are due to alteration of the mitral. The nurse also compared the heart rate of a young male and the rate speeds of respiration slows down and expiration. Sinus arrhythmia. Client present with following signs: symptom, weight gain, heart failure. What oscillation in the interjugular veins reflect? Change in pressure in the right atrium. Wait, jugular vein. Right atrium? Right? Yeah. Well, as in assessing adult client, the nurse detect snap early is mitral venous stenosis. When oscillating, she listened to the acid pacing sternal border, find a consistent closure of the witch valve. Second intercourse. Oh, this is second. So this is try. No, wait. Mitral. Aortic. No, wait. Tricuspid and mitral? Second intercostal. Oh, and the right? Oh, a second intercostal on the right sternal border. Servants finding consistent closure which valves. If a second in the right intercostal, it should be aortic and pulmonic. The nurse is palpating the apical impulse. Heart disease found that what? Nurse is palpating an apical impulse in the client with heart disease and finds that the amplitude is diffused and increased. Which of the following condition could be potential cause of increase in amplitude of impulse? Mitral stenosis with volume overload in the left atrium. Apical impulse. Mitral, the left atrium. Triggers auscultation of the client heart sound reviews the presence of a split S1. What conclusion should the nurse draw from this assessment finding? That arterial valve is incomplete. Incompetent. Client's ventricles are not contracting simultaneously. Client's left ventricles ventricular or hypertrophy. Client's aortics are not synchronized with ventricle. I think it's aortic incompetent. The nurse assessing the older adult client's heart and neck vessels when attempting to palpate the client's apical pulse. What principle should guide the nurse's actions? I have a more medial location than younger clients. A client might have aortic regulation murmur. The best oscillation in murmur. Left lateral decubitus. Wait, is it for regular murmur? Wait, no, murmur, lean front, lean forward, murmur, lean forward. Community health nurse is planning a screening day for blood pressure and cholesterol. What kind of prevention would this be? Community? Which of the following intervention scanners used to help client modify risk factors associated with hypertension, provide information aids to promote smoking cessation? Honestly, I don't know what the fuck cessation means. Stop. Yes. Ask the client to keep an active log. Yes. Encourage the client to limit consumption. Yes. Wait, potassium-rich food? Yeah, well, it's not exclusive to okay. Ask client to keep a typical day record of daily food intake. Encourage client to quit alcohol consumption. And there's a text breathes on the auscultation of the carotid artery, which precaution should the nurse take during the remainder of the physical assessment of the carotid arteries. Perform only auscultation. Avoid frequent repositioning. Make client sit upright. Perform palpitation lightly. Carotid. Perform palpitation lightly. Nurse understands the cardiac event that signals the beginning of the systole and produce the first harsh sound is the closure of the mitral and tricuspid valve. I got a lot of this wrong this time. Nurse care for client expecting this dyspnea. The nurse auscultate. I'm giving myself a treat. I'm giving myself a piece of candy. Oh shit. What the fuck? They timed me out. There we go. I don't know if you guys feel like this, but sometimes when I study a lot, I want to eat something when I study or like when I do homework, which is bad. I want to snack when I do these things, which is bad because I'm sitting on my ass already. Should I treat nursing student proper techniques of assessment of heart, neck vessels? Understanding. You know what I mean? Sometimes do that too. Yeah. Studying is hard and boring, so I need to find things to distract or compensate myself. Eating is one of them. It's so hard to find something else to like scratch that itch. While also like staying focused. I have a suggestion about dancing at the back. Maybe add other movements like standing still, sit. I'm too lazy to make other movements. It's okay. We're just here to chill. Also, I'm not really looking at GeoGX most of the time. I'm just looking at my screen and I do my exam, my little quiz. I drink quite a lot of coffee too. That's a bad habit. I realize coffee actually doesn't help me much, and sometimes give me a headache. So now I'm drinking water. You know how to say water in Irish? Whoa. Or might. No, that's Australian. Oi. Pass me a bottle of water, eh? Water? 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 What? 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 Hello. Oh my god, I finally got my mastery level to 7. Jesus Christ, I took like I did like 80, but no. I did over 150 questions to get my mastery level 7 on this topic. Jesus Christ. You I don't know how to say that. I don't know how Irish things are really hard to pronounce. I literally cannot pronounce these things. It means holy water in English, calls it whiskey. Oh. Whiskey. Izzy. Oh, it's whiskey. But a pint of whiskey. Whiskey. So you're drinking water, holy water, good for study. I'm so tired. I'm just writing down things that I got wrong. Like, why I got wrong and shit. Holy shit. Quitting smoking for the first year can reduce risk of cardiac events by 50%. Wow. Yeah, it's important to know you made those mistakes in order to prevent reoccurrence. Yeah, even though like those questions reappeared and I got it right, I still sometimes like fucked it up, you know. Okay, I finished my homework kind of. Ready? Submitted. Good. What the fuck is this? Oh. Mm. Okay. I kind of want to... Okay, I know it's 11:41, but I really want to get... No, I shouldn't. I'm out of water. That means I have... I don't want to go out. If I get out, I feel like when I get water and I'm going to get a snack and it's 11:41, which I don't want to eat. That's just late. Should I get a cookie? Look, should I fucking steal a few pieces of cookie while I get water? I have 30 more minutes to study. Should I do it? Treat yourself. Okay, I'm going for it. Guys, my dad is also studying right next to me in the next room. My dad is also studying for his stuff. And he's also doing like questions, like practice questions. And while my mom is downstairs with like a family friend talking really loudly the whole time during me and my dad studying. Oops. You already drink whiskey, so it's okay. Bad for your health, good for your sanity is always good trade-off. I ate a piece of matcha cookie and it's had like a little 即好似白，我唔知你知唔知白之戀人 cookie 係即係嗰隻曲奇跟住中間有啲 cream 嗰個咧，不過呢個係綠茶味嘅白之戀人 matcha cream cookie. It was delicious and it fulfilled my my filling, my emptiness of, I don't know, studying. Motivated by Papa Curry, hard work. Yeah. I had to brag about it. I was like, I just finished 160. I just put 160 questions about the heart. Cookie power, yes. Okay. What the fuck did I just witness? I just got into fucking Instagram. You see fucking Love in These Face chibis of the boys in horse costumes. What the why is Silas looks like he's doing Gundam style? Insane looks so fucking stupid. Oh my god, Zeri is so silly. What the fuck are these chibi MMD models for the year of the horse? What the fuck? Welcome to 2026. 新年快樂，恭喜發財！恭喜發財，萬事如意，心想事成，龍馬精神，萬事如意，大吉大利，精神常處，年年有餘。I don't know。每次以前喺香港嘅時候見其他屋企人要你講一紮祝賀説話，超級煩。No, it's not. It's like Monday. Well, Monday for me. I think it's Tuesday for you guys. Monday, Tuesday-ish. I think. Tuesday? girls are unforgettable. They seem to keep us on top. Some kisses so hard, another popsicle. Uh-oh, my tummy is hurting. Uh-oh, my tummy hurts. Uh-oh, not good. Tummy hurts real bad. Is it gonna pass? I don't think so. Uh-oh. Guys, I'm ending this study session early because my tummy hurts real bad because of the period. Yes. Because of the cookie? I don't think so. But my eating of the cookie might activate my stomach, which also activates my intestines, and my intestine starts moving. So maybe it activated something. Anyways, thanks for watching. I studied for like 2.5 hours at least, I guess. It's not too bad. It's alright. I'll keep studying tomorrow as well. I don't know if I'll stream. Maybe I will. I don't know. I am forced to eat dinner tomorrow as well. So maybe a morning study stream and then a nighttime study stream. Because I do really need to study. I hope you got your dinner stream. Thank you. Thank you for accompanying me to study. Yeah, I have an exam the exam is on Monday. So I gotta log in. And I also have more other exams. I have 2 more exams other than the one on Monday. So I'm cooked. But hopefully with all the practice labs and experience I have, I can pass them. But anyways, let's say goodbye to everyone. Eri otsukare. Lamkin otsukare. Kyrie otsukare. Nicholas otsukare. Timothy-san otsukare. Ren-san otsukare. Owashima Pussy-san otsukare. Gary Jackie-san otsukare. Wandeep-san otsukare. Joe-san otsukare. Did I miss someone? I feel like I missed someone. Gary Jackie-san otsukare. Good luck on quiz test exams. Yes, I have exam and 2 skill tests. And if I pass one of the skill tests, I go the next. We don't have class anymore after the skill test. It would just be clinicals, and I'm going to die because it's Saturday morning at 6:30 a.m. That means I gotta be there. Of course, the first day is gonna be 30 minutes early or some shit. I'm gonna be 30 minutes early to get myself ready. That means I'm gonna have to wake up at 5. So I won't sleep that Saturday. Yay! Skill set. Don't ingest bubble into your patient. Yeah, I do have to do that actually. Because my skill test, one of them is med injection. So I will have to like try to flick those bubbles out of the needle, the syringe, like you see on my Valentine's Day stream. It is so fucking frustrating to get those bubbles out. Piss me off. Anyways, my stomach hurts a lot. I'm going to leave. Goodbye. Have a nice day. If you gotta eat, go to eat. Go to sleep. Do the thing you gotta do. Have a nice day. Wait, what the fuck? Hold on. Let me see. Let me see if anyone's streaming. 嫲嫲開緊台，嫲嫲開緊，嫲嫲個唔係喎，嫲嫲應該嫲嫲同我一樣時區嘅喎，佢已經過咗情人節噶啦，不過佢過咗遲咗嘅情人節台，跟 AI 做情人節腦動朱古力 ，Oh my god！ 係咯，如果大家仲未夠厚，情人節未夠厚，可以去睇下嫲嫲嗰邊同 AI 整朱古力。Let me see anyone else. Maybe that's it. Goodbye. I will see you tomorrow, maybe on more studying streams. Thank you so much for accompanying me, even though I don't really say much in the stream today. Good job. Alright, thank you for watching. Bye bye. お疲れ。Bye bye. 啾。Cuddle-san, you're late. My stomach hurts. So, well, it was gonna be like 15 minutes. Like, I still have 15 minutes of studying, but my stomach hurts. So I have to end early because I feel like my stomach hurts. So yes, goodbye. My tummy hurts. I need to go. I'm sorry. You missed it, Cuddle-san. Happy Valentine's Day. Watch my Valentine's Day stream if you missed it. I don't remember if you were there because I was so sleep deprived. Okay, bang, you were there. I think you were there. You stream to watch. No, I'm not gonna stream in my toilet. No. Disgusting. I'm leaving. Happy early Lunar New Year. Haha. 今日咩啊？除夕、除29、甚至31。I don't know. Bye. I'm leaving. Bye. I upload a picture with my shitty dry curry, but I'm not streaming it. I have a picture of me on the toilet, but I'm not fucking streaming it. That is disgusting. Very different. On the toilet versus actually shitting in the toilet, streaming it, very different. I'm not that kind of streamer. But I will put an urethra or a colonostomy on you. I will not shit, but I would handle people's shit. Okay, I gotta go. Bye.